I am Anycia Grady. I'm a clinical social worker with 2020 Life Counseling. I just want to preface that I had to whip out the sweater today with the snow in May, but that's a whole nother conversation here in Cleveland. But needless to say, I wanted to discuss today how the physical body and the emotional mind are interconnected. I think a lot of times we tend to forget that our brains are a very powerful part of our bodies. And in essence, it's how we live. Without brain function, there is, in essence, nothing. But there's a word or a phrase that I would like to educate about tonight that I think would help for those who are enduring some level of pain, and that is somatic symptoms. Somatic symptoms is when your emotions that go unprocessed turn physical. So for instance, if you are struggling at work and life is getting more cumbersome, there are a lot of more tasks and your supervisor is becoming more demanding, typically that results in a headache, increased anxiety, some tension in the neck. Those are somatic symptoms when your stress turns into physical symptoms. And sometimes it requires a second or a third provider to be able to look at it. A lot of times we go to our medical providers when we have this increased tension or insomnia. And sometimes that helps temporarily, but it doesn't resolve the root issue, which is the emotional mind. I have been wanting to highlight a particular agency in the community, Massotherapy, regarding their interconnectedness with understanding how the physical body and the emotional mind tie together. Cara Perez is the owner of Massotherapy, and in collaboration she has expressed how there have been situations where she has provided services of support to her clients, but also understands that there is a cognitive or mind emotional piece that ties into it. And a lot of times if we do not tackle the emotional mind, the physical pain will, though reduce with the physical health providers and massage, without processing it with a therapist or a clinician who understands the emotional mind, those symptoms continue to linger. So I would suggest that if you are having some physical pain, to rule out if it is an emotional trauma or emotional stress that is reinforcing the somatic symptoms.